Hello everybody. Those of you who were at the workshop in Gdansk remember me. I will speak about how to use health argument in promoting active travel. Those of you who were in Gdansk remember what I said about how health arguments should be. They should always be simple, clear, verified, and tailored. What exactly does it mean? I will explain later, and how it works in a practical way, Randy will explain after my presentation. And to warm you up, I would start with the first question for you, and I invite you to answer to this question. Okay. Most of you agree that additional walking is always healthy. That's a perfectly correct answer, and you should maybe you can use questions like this also when you are addressing your target group or when you are doing personalized travel planning. Also, it's important to have the right arguments for the right target group. Different target groups might be interested in different views on promotion of active travel. Employers are mostly interested in cost-benefit data, on data how to decrease absenteeism, how to improve productivity, and similar. Employees, they find it more interesting if they hear about time-saving exercise, about the health benefits of physical activity, how to reduce sitting time. If you're talking to parents about active travel for their children, mention benefits for the motorical, physical, social, and psychical development of their children, how to reduce their sitting time. And last but not least, you might have also elderly and chronic patients in your target group. They could be interested also in benefits for health and functional capacity, but to those you should also mention possible limitations and warnings. If I sum up the health arguments into the most important ones, we have three. They are active travel as health-enhancing physical activity. The second view is reducing sitting time, and then the third one is maintaining functional capacity. If you use health-enhancing physical activity as your health argument, don't forget to mention the substantial benefits for health, that you need 150 minutes of moderate physical activity weekly or 30 minutes daily. Give a simple and easy to understand definition of moderate intense physical activity, and also give some example how to include daily activity into the total amount of physical activity. And now we have our second poll question. I invite you to give your answer. Thank you very much. That's right. If people depend somehow on public transportation or even car use, it doesn't mean that they cannot include active travel at least as part of their travel. And you should always have in mind to mention that you mostly can include at least a minimum amount of physical activity or active travel, even to those who are actually driving to work by car or by public transport. Reducing sitting time is an emerging health aspect because sitting time is a very important independent risk factor for several chronic diseases like heart diseases, diabetes, obesity, and similar. And sitting time is increasing, especially in children. So that argument is very important in all age groups. And don't forget to say that any kind of physical activity, even if it's low intensity, like slowly walking or even standing, can reduce the sitting time. And practical information is, for example, how to reduce sitting time while using public transport. Even if you are driving by bus or train, you can still reduce your sitting time with standing for a station or two or the entire way if it's not very long. And we have now question 3. I invite you to answer to that question. Thank you very much. All of you are right. Children need a lot of physical activity, at least 1 hour per day, and it's important that they are doing different kinds of physical activity, different intensities. So even if they play sports regularly, it's still important for them to walk or to cycle to school because besides of the effects of physical activity to their health, they also learn about responsibility, about environment, about traffic, and the effects are way more important than only the physical aspects. So it's never too early to start walk or cycle with your children. Maintaining functional capacity is a very important issue in elderly people and chronic patients, and it simply means the ability of doing your daily stuff, like taking care for yourself, be able to walk up and down the stairs, be able to go to the grocery store, and doing housework and similar. And it's very crucial in elderly and chronic patients. And regular physical activity has a very important role in maintaining this capacity. And active transport can serve here as a daily exercise, not only in terms of physical activity, but also to keeping elderly people fit and ready and prepared for daily activities inside and outside their homes. And we have now question number 4. Please feel free to answer on it. Okay. Thank you very much. And you are perfectly right. It's never too late to start a new activity. Of course, one should always pick an activity that is suitable for one, and with a little help of family, of children or grandchildren, even cycling or at least walking should be possible. What also works very well when using health arguments are information about costs of physical inactivity and, on the other side, cost-benefit analysis of active travel. Why are costs of physical inactivity so important and so attractive? As you can see here, there are numerous scientific papers and articles on that topic. It's because physical inactivity is one of the most important risk factors for diseases. It increased the global burden of diseases in terms of money, health status, absenteeism, and so on, and it costs major direct and indirect costs. Those information are not that much interesting for individuals, but maybe more for different stakeholders or organizations you are working with. Cost-benefit analysis are usually quite attractive for employers and stakeholders because they can see very directly, and you can show them with very direct examples what they gain from promoting active travel for their employees. Be sure that the arguments you are using are evidence-based. You have here again some examples of scientific articles, researches and papers. Those who I picked here are freely accessible for everyone, so if you just have a look, you can always find verified and scientifically evidence-based information. And again, a question for you. Please give your answer. Okay, thank you very much. And again, you are perfectly right. It's very important to do it together. Even if you have some second thoughts or you are worried, it's more important to get your children active, to start to teaching them to be independent, and if you are doing it together, you will be more successful. And for the last, when you're using health arguments and personalized travel planning, you need some information about your target group. Besides the basic information like distance, infrastructure, and accessibility, it's very useful to know what are the exercise habits of your target population, how often, how long, how intense they are doing any kind of physical activity. Then, especially in elderly people, it's important to know what is their health status, if they have any chronic conditions or reduced mobility. And last but not least, the social support. If the surrounding, the family, friends, co-workers are encouraging the use of active travel, your campaigns will be way more successful as if the social support is weak. So do ask your target groups about this information. And now we have one more question. No.
Janet, I don't want to interrupt you.
It's the last one.
Okay.
It's the last questions, and then we are finished. Please feel free to answer. Thank you very much. There's no argument against some serious exercise, but physical activity is not limited only to organized or group exercise. You can start to walk or cycle to start with regular physical activity slowly, and even later you can combine those activities by walking or cycling to your exercise classes or similar. The point is that health-enhancing physical activity is not only exercise, even active travel can be or is a very important part of it. And here we are at the end of my presentation. I thank you for your attention.